the CCG, I've been doing a number of pieces of work. I sit on the governing body of the CCG, so I'm involved with the decisions which shape the direction in which the organisation is travelling. On a more clinical sense, I'm involved with end-of-life care. So myself and my colleagues who work in that part of the CCG are very keen to improve the experience that patients and their carers and families have when they enter the last year of their lives. Well, at the moment, if we look at end-of-life work, end-of-life care, it's fairly fragmented. GPs do some of it, district nurses do some of it, the hospice, the hospital, the Macmillan service, lots of different people are involved with end-of-life work. Informally, you have carers and patients themselves, of course. And we're trying to bring together some of the little bits and pieces and make the whole service a little bit more stuck together, a little bit more cohesive. Also, in doing that, we're trying to ensure that patients are able to spend their last few days and weeks in the place of their choice. We know from research that has been done, a lot of patients don't want to die on a bed in hospital or on a trolley in A&E if the services exist to support them ending their days with family and friends at home. So one of our current priorities is to find out where patients want to end their lives, when they want to finish their days, and increase the percentage of patients who die at home in their preferred place of care. What we're trying to achieve really is quite simple. We're just trying to ensure that people in Suffolk, in the Ipswich and coastal area, the patch we serve, get the best quality healthcare that we can possibly arrange for them, and that's done in a cost-efficient way. The government allocates us about £1,100 per patient, and we're just trying to ensure that we spend that money wisely. We get good quality services for our patients, the sorts of services that I would want to use myself or my family would want to use, and that we spread those services as equitably as possible. We don't want anyone to be disadvantaged. So it's quite simple in a way what we're trying to do. Doing it's a little bit more difficult.